Hello, I'm Jennifer Collins, registered nurse and nurse manager for Pelham Medical Center's 4th floor orthopedic unit. Thank you for choosing Pelham Medical Center for your spine surgery. Our team of experts are dedicated to providing you with the best medical treatment available, and we want to make sure your stay with us is as comfortable as possible. Welcome to part 2 of our 3-part Spine Camp Education series. In this video, we will give you information about what to expect from the day of your surgery until you are discharged to go home. The information presented in this video series can also be found in your spine surgery patient guide. This important guide serves as a comprehensive resource of education and information for you from the very beginning of your spine surgery journey and beyond, and we encourage you to read it in its entirety. Enhanced Recovery After Surgery, also known as ERAS, is a modern treatment program for surgical patients used by our spine surgery team. The goal is to help you return to a healthy state as soon as possible after surgery. Every part of our spine surgery program has been carefully planned and orchestrated as part of the ERAS treatment plan. Achieving the best surgical outcome for you is our number one goal, and the process from this point forward can be described using the acronym DREAMS. Let's take a closer look. Drink. Drinking water will keep you hydrated for faster healing and reduced constipation. Reduce stress. You will receive medications to decrease your body's stress response from having surgery. Eat. You will be given crackers to eat soon after your surgery, and your food intake will progress as tolerated. You will be encouraged to eat protein with every meal to help your body heal. Analgesia. We will give you medications and anesthesia before, during, and after surgery to help manage the amount of pain you experience. Move. You will move to improve after surgery. We will get you moving as soon as possible after surgery to promote circulation and healing. Sleep. Your body needs to rest to help it recover. We use dreams to get you back to you as fast as possible. On the day of your surgery, you will enter the perioperative phase. On your surgery day, arrive at the scheduled time and check in at the surgery waiting area on the 2nd floor. When your name is called, you will be directed to a pre-op area where a registered nurse will greet you and give you a gown and special socks to change into. One person will be allowed to stay with you while you are in the pre-op area unless the hospital is under special visitation restrictions. The nurse will help you get comfortable and review information with you that was obtained during your pre-admission testing appointment. The nurse will place an IV in your arm to start IV fluids and an antibiotic. You will also receive medication for pain and nausea before you go to the operating room. Someone from anesthesia, as well as an OR nurse, will introduce themselves and review your information, answer questions, and provide explanations about what happens next and what you can expect. Almost everyone you meet on this day will ask for your name and date of birth. This is not because they don't know it, but a safety precaution for you. There are several anesthetic techniques available for spine surgery. The 3 most commonly used are spinal anesthesia, general anesthesia, and peripheral nerve block. With spinal anesthesia, an anesthetic is injected near the spinal cord to block pain from an entire region of the body. This technique is used in conjunction with IV sedation and a peripheral nerve block. Most spine surgeries will occur under general anesthesia. When using general anesthesia, once the patient is unconscious, a breathing tube is placed in their windpipe, and the anesthesiologist delivers an anesthetic gas through the breathing tube. This type of anesthesia affects the entire body, brain, and nervous system, leaving the patient in an unconscious state during surgery. A peripheral nerve block is sometimes used to help decrease pain after surgery. A local anesthetic is injected near a specific nerve or group of nerves to block pain from a specific area. Before your surgery, the anesthesia team will talk to you about the details of your anesthesia plan. When everything is ready and it's time for your surgery to begin, you will be wheeled into the operating room, which is also referred to as the OR, and transferred to the OR table. The OR staff may again ask you a few questions, such as your name, birth date, allergies, surgery site, etc. The anesthesia specialist will then guide you through the sedation process, and your surgery will take place. A Foley catheter may be inserted into your urethra for urine output once anesthesia is administered. If your procedure is outpatient and you are going home the same day, you will most likely not need a Foley catheter. Spine surgeries generally take 2 to 6 hours on average. Your family can wait in the surgical waiting area on the second floor, and they will be updated periodically on your condition. Now that your surgery is complete and you are on your way to being a brand new you, the post-operative phase begins. When the procedure is over, your surgeon will call the surgical waiting area or come to the private post-op consultation room if possible to let your family know how the surgery went. The operating room staff will move you from the operating room to the PACU. PACU stands for Post-Anesthesia Care Unit, otherwise known as the recovery room. While you are in recovery, a nurse will assess your status and vital signs on a constant basis. They will continue to administer pain and symptom management, and if you have a Foley catheter, it may be removed. However, if you have lumbar surgery, your Foley catheter will not be removed until the next day. The PACU nurse will encourage you to begin eating and drinking. And once you are stable and a room is available, you will be transferred to the orthopedic unit. When you get to your hospital room, you will have access to a program called MyChart Bedside. There will be an electronic tablet in your room that will provide you with a variety of activities, such as checking your latest lab results, a way to message your nurses and doctors, and a way to receive clear, non-technical explanations about your treatment. Through MyChart Bedside, you will even be able to request a pillow, get a snack when you are hungry, and see bios and photos of the members of your care team. In order to use MyChart Bedside, you must have a MyChart account. If you have not already signed up for Spartanburg Regional Healthcare System's free MyChart patient portal, you can do it now by calling 1-888-84-CHART or ask about it at your physician's office. In addition to MyChart Bedside, we have a care board in each patient room. These dry erase boards list important information about your care team and treatment plan, such as staff names, contact information, therapy plans, and pain management details. Each room is equipped with call lights that are easy to reach, so you can use them to ask for assistance at any time. For your safety, we ask that you use this call light to request assistance every time you need to get up. There will be a blue folder in your room that contains a patient information handbook, TV guide, and other information that may be helpful during your stay. Please be sure to bring cases and containers to keep in your room for any removable dental appliances, dentures, glasses, or hearing aids. You will be able to identify some of the people in our facility by the colors they are wearing. For instance, surgical staff wears royal blue scrubs. Nurses wear black or white scrubs. Your inpatient service associates will be wearing scrubs that are cranberry or Caribbean blue. Respiratory therapy wears royal blue scrubs, and your PT and OT therapists will either wear business casual clothes or scrubs. Of course, everyone will be wearing a name badge for identification purposes. Our orthopedic unit is dedicated to the specific needs of orthopedic surgery patients. This includes private patient rooms and a 24-hour nursing staff of nationally certified orthopedic nurses. Therapy is available 7 days a week, and nurse leaders round on all patients. Your body starts to lose strength after only 1 day in the bed, so the more active you are after surgery, the stronger you will be, and the quicker you will recover. A process called progressive mobility is a part of the Enhanced Recovery After Surgery or ERAS plan. The first step starts as soon as 2 hours after surgery, when you will sit up on the edge of your bed. Additionally, you can expect to be sitting up in a chair for all meals and as much as tolerated between meals. Your care team will work with you to move to improve during your hospital stay. While we encourage you to be as active as possible, a member of our staff must be with you when you get in or out of the bed. Use your call light to ask for assistance. A case manager will come by to discuss your discharge plans and assist with acquiring any equipment that might be helpful for you at home. They will also set up home health or rehabilitation as needed. You will be encouraged to eat and drink to aid the healing process. Protein supplements may be provided with meals to help with your post-surgery nutrition needs. Surgical site infection prevention will be an important part of your recovery. Eating a healthy diet, staying hydrated, and getting adequate rest are important to keep your immune system working well and aid in your recovery. Avoid picking, scratching, or pulling at your incision, and don't use oils, lotions, or creams on or around your incision unless directed by your surgeon. Hand washing. Everyone, including doctors, nurses, and you, should wash their hands before touching or caring for your incision. Blood clots are a serious preventable condition in patients who have undergone recent surgery. They are primarily caused by poor blood circulation due to spending a lot of time in bed after surgery. Deep vein thrombosis, or DVT, occurs when a blood clot forms in the deep veins, most commonly in the arms or legs. An occurrence known as a pulmonary embolism, or PE, can occur if a DVT breaks off and travels to the lungs. Our surgical team utilizes 3 important strategies to reduce the risk of blood clot formation. The first one is walking. Walking, even just a little bit, is important for circulation and the prevention of DVT. The second component is sequential compression devices, or SCDs. They are sleeves placed on your feet or legs after surgery. They will inflate and deflate in a rhythm to assist with circulation while you are lying down or sitting in a chair. The third tool is compression stockings, which also promote better circulation. During your hospital stay, you will have around-the-clock nursing care. The orthopedic nursing care team will round regularly to ensure your needs are met. The rounding schedule is every hour between 6 a.m. and 10 p.m., then every 2 hours from 10 p.m. to 6 a.m. If we notice you are asleep during rounds, we will do our best not to wake you unless a medical order requires it, such as checking vital signs or giving medications. After your surgery, you will receive a breathing tool called an incentive spirometer. This tool is used to encourage deep breathing and prevent the pooling of fluid in the lungs, which can cause pneumonia. It is strongly recommended that you use your incentive spirometer for 3 to 4 breaths every 15 minutes, with a goal of at least 10 times every hour while you're awake. After surgery, you should expect to have some post-operative pain. Our goal is to control the pain at a level that allows you to rest, as well as participate in our physical therapy. Pain is one of the biggest concerns for anyone having surgery, and we want you to know what to expect. First, just know that you will have pain after surgery. However, our goal is to keep your pain managed at a level you can tolerate and still function properly. Your physician will order different types of medication that will be available depending on your level of discomfort. It is important for you to know that medication is not the only option we can offer for pain relief, and our staff is expertly trained in alternative pain relief strategies. We care about how you feel, and you will be asked very often about your pain level using a 0 to 10 pain scale. The pain scale helps us rate your level of pain by linking the way you feel to a set of numbers from 0 to 10. 0 is no pain, and 10 is the worst pain imaginable. As we said before, you will be asked on a regular basis to rate your level of pain. Pain medication will be provided as needed, so keep your nurse informed about how you are feeling. Types of pain medications include IV opioids. These are narcotic medications such as morphine that are given through an IV and are indicated for severe pain. Oral opioids are narcotic pain medications that are taken by mouth, and they are indicated for moderate pain. Some commonly used oral opioids include oxycodone, fentanyl, codeine, and Dilaudid. Anti-inflammatories. This class of pain relief drugs are also called NSAIDs, or nonsteroidal anti-inflammatory drugs. They reduce pain by decreasing inflammation in the body. Some commonly used NSAIDs are ibuprofen, Celebrex, Toradol, and aspirin. Typically, IV pain meds are only used shortly after surgery, and you will transition to oral pain medications to control your pain when you can tolerate fluids and food by mouth. There are natural pain management techniques that can be used after surgery to counteract the negative effects that stress and pain can have on your body. Learning the art of meditation and diaphragmatic breathing will help your body relax. Simply using your imagination to visualize and concentrate on something that makes you happy, like a puppy, a beach, or a lake in the mountains, can trigger the release of chemicals in your body that block pain signals and reduce stress. Information about how to practice these techniques is in your spine surgery patient guide. Your case manager will take care of your discharge planning. Before you can go home, decisions need to be made for things like when you can leave the hospital and what you will need when you get there. Your case manager will meet daily with your care team to monitor your progress. And if everything is going well, you should be able to go home 1 to 2 days after your surgery. If your care team does not think you are ready to go home when you leave the hospital, your case manager will arrange for you to transition to a short-term skilled rehabilitation center. In the meantime, your case manager will order any medical equipment you might need and arrange for home health and/or physical therapy visits if appropriate.
Hello, my name is Kristen Stanley, and I am a physical therapist at Pelham Medical Center. Our team of occupational and physical therapists are here to work with you during your post-surgical phase of your spine surgery experience to ensure that you have a safe and successful recovery. Let's take a look at what you need to know and what you can expect regarding physical and occupational therapy after your surgery. It cannot be stressed enough that active participation in physical therapy is one of the most important aspects of your successful recovery. For the first 2 days after surgery, you will work with a physical therapist twice a day, morning and afternoon. If you are still in the hospital on the 3rd day after surgery, the frequency of your physical therapy may be adjusted according to your needs. Soon after your surgery, you will meet with the physical therapist who will evaluate your strength, range of motion, safety, ability to safely transfer in and out of bed, and your ability to walk. He or she will also discuss your home environment, your prior level of function, and recommended equipment for use at home during your recovery. Your physical therapy activities will include strengthening exercises, getting in and out of bed, standing up and sitting down, walking with a walker or other device, and negotiating stairs by going up and down. Your therapist will work with your case manager to ensure you have the proper equipment before you return home. Physical therapy is the key to your recovery, and it is the key to getting your motion, strength, and mobility back. Physical therapy is hard work, and each day your therapist will ask you to do a little more on your own. Why is physical therapy so important? Because our goal is to help you reach the necessary milestones that will allow you to go home and get back to doing the things you love. In addition to physical therapy, you will also take part in occupational therapy, which is also referred to as OT. This will prepare you to do activities of everyday living while you are recovering from surgery. Your occupational therapist will teach you how to use adaptive equipment and special strategies that will protect your spine as you go about your daily routines at home, such as putting on shoes and socks, reaching for things, and taking a shower. Our goal is for you to be safely independent. At this point in your spine surgery journey, you will be well on your way to living your best life. Please know that our team will continue working with you to ensure that you have a safe and successful recovery. And we look forward to seeing how much you have progressed when you come to see us for post-surgery visits. Everyone on your spine care team at Pelham Medical Center realizes that having spine surgery is a big milestone in your life, and we want to thank you for entrusting us with your care.